Have you ever wondered how a clinician can get a clear, in-the-moment picture of someone's psychological state? Well, they have a foundational tool for that, and it's called the Mental Status Examination, or MSE for short. Let's dive into exactly how this essential technique works.
So the best way to wrap your head around the MSE is to think of it as a psychological snapshot. This isn't about digging through someone's entire life history. Nope, it's all about the here and now. It's a focused look at the client right at this very moment, during the interview. It's really a structured way to observe and understand their current mental state.
All right, so how do we actually take this snapshot? First, we'll cover the basics, appearance and behavior. Then we're going to move inward to a person's thoughts and perceptions. After that, we'll look at higher mental processes. And finally, we'll see how it all comes together to point toward a diagnosis.
So why is this snapshot so incredibly important? Well, it's way more than just a casual chat. The MSE is a really structured process that turns simple observation into vital clinical data. The MSE actually does a few really critical things. For starters, it gives us a baseline, a clear starting point so we can track a client's progress over time. It also helps clinicians organize everything they're learning, balancing what they can see, that's the objective stuff, with what the client tells them, the subjective stuff. And this whole process, it doesn't just confirm details from the client's past, it's what lays the groundwork for a diagnosis and ultimately a good treatment plan. The whole examination kicks off with what you can see right away, the client's appearance and how they're behaving. This is kind of like the first layer of information that the clinician starts to gather.
Clinicians are looking at these things pretty systematically. They'll notice things about a person's general appearance, like how they're dressed, their grooming, and hygiene. They'll also be asking themselves, is this behavior what I'd expect for someone this age? And crucially, they're looking at the client's attitude toward them. Are they being cooperative? Or maybe a little guarded? Or are they even hostile? All these little details start to build the initial framework for the whole assessment.
Okay, now this is a really fascinating and critical distinction in the clinical world. Mood versus affect. Think of it like this. Mood is what the client tells you they feel. It's their internal emotional climate. They might say, I feel anxious, or I've been feeling pretty down for weeks. But affect, that's what the clinician sees. It's the external expression of emotion that you can observe in their face, their tone of voice, their body language. So a client might tell you they feel fine, but their affect could be totally flat, or they might look like they're about to cry. That mismatch, that's really significant.
All right, so we've looked at the external signs. Now, let's go a little deeper. We're going to explore the really complex world inside a client's head, their thought processes, and how they perceive reality.
So when it comes to assessing thought, clinicians are looking at two key things. First, there's the form of thought, which is all about how a person is thinking. Is their thinking logical, coherent, or does it seem kind of disorganized and hard to follow? Then second is the content of thought, which is what they're actually thinking about. Are there worries that keep coming up, certain themes, or maybe some unusual beliefs? You've got to understand both to get the full picture.
And this leads us to two really important potential findings. A delusion is a disorder of thought content. It's a belief that's false and fixed, something a person holds on to no matter what evidence you show them, like believing that they're secretly being monitored. Hallucination, though, that's different. It's a disorder of perception. This is where someone has a sensory experience. They see, hear, or feel something that isn't really there, and it can happen with any of the five senses.
Okay, so beyond thoughts and feelings, the MSE also has to evaluate a client's cognitive functioning. You can think of this part of the exam as checking the mechanics of the mind.
Right here, clinicians are basically running through a quick systems check. It starts with orientation. Does the client know who they are, where they are, and what the date is? Step 2 is attention. Can they actually focus on the conversation? Then comes memory, where they check both what happened recently and things from long ago. And finally, they get a general sense of the person's overall intelligence and reasoning skills.
And this brings us to a concept that is just so important: insight. Insight is really all about the client's awareness and understanding of their own situation. The big question here is, does this person recognize that they might have a problem or an illness, and do they get that they might need help? A client's level of insight is a huge factor in whether they'll be willing to engage in treatment. So we've gathered all this information, from their appearance to their thoughts to their cognition. The final step is to put all these pieces of the puzzle together into one coherent clinical picture.
This quote from our source material just nails it. All of these structured observations we've been talking about, they're all designed to lead the clinician toward a diagnosis. And even if they can't land on a final conclusion right away, it lets them form what's called a provisional diagnosis, which is basically a working hypothesis.
So why is that provisional diagnosis so important? Well, it's so much more than just a label. It gives the clinician a framework for understanding the client's symptoms, for exploring what might be causing them, that's what we call etiology, and most importantly, for developing a therapy plan that's actually targeted to help. The MSE basically provides the map for the entire therapeutic journey ahead.
So, when you step back and look at it, the mental status examination shows us something pretty profound, doesn't it? It shows how a structured, intentional observation can transform a simple human conversation into an incredibly powerful diagnostic tool. It turns what you see into real insight, giving you that clear, actionable snapshot of the human mind. It kind of leaves you wondering, just how much can we really understand from a single moment in time?